Hi, my name is Madeline Mailing. I will be doing my presentation over neuropsychological assessment of response inhibition in adults with ADHD. So first we're going to do an overview of the entire presentation. First, we're going to go over the introduction, background, methods, results, implications, and conclusions. This article reviewed today is Neurological Assessment of Response Inhibition in Adults with ADHD by Epstein et al. Each section of the presentation will go deeper into details of the study. To start off, we will focus on the introduction and background of this study. We will cover what ADHD and response inhibition are, as well as main points and research questions guiding the study in the context of the purpose of the study. The acronym ADHD stands for Attention Deficit Hyperactivity Disorder. People with ADHD oftentimes struggle with several cognitive and behavioral symptoms. These symptoms can all be classified to fall into one of the three categories listed on the screen: inattention, hyperactivity, or impulsivity. Symptoms include, as outlined by the article, poor sustained attention, poor motivation, inability to respond to behavioral consequences, and deficient response inhibition, which is the focus of this presentation. What is response inhibition anyways? Response inhibition is the ability to suppress actions that are inappropriate in the context of the situation. For example, if you're in a lecture and your phone vibrates in your pocket, ignoring that vibration and suppressing the instinct to take it out and check who's texting you is an example of response inhibition. People with ADHD struggle with tasks like this and thus are deficient in response inhibition. The article reviewed today showed that adults with ADHD exhibited deficits in response inhibition on one of the three neuropsychological tests given. The test in question was the Continuous Performance Test, or CPT. This test measures the participants' sustained and selective attention, so it was expected that those with ADHD would perform more poorly than the other two groups tested. However, because this participants with ADHD only performed with deficits on the CPT and not the other two tests, more research should focus on how different neuropsychological tests or tasks target different areas of brain functioning. It is possible that the participants with ADHD perform with deficits in response inhibition because of the type of task the test asked the participants to perform. Some research questions that guided this article were: do adults with ADHD have similar difficulty with response inhibition as children with ADHD? How do adults with ADHD compare to anxiety disordered adults regarding response inhibition? The reason researchers are concerned with this question in particular is because anxiety disordered adults are thought to be on the opposite side of the spectrum of response inhibition when compared to adults with ADHD. Going into the context of this study, many past studies have supported the hypothesis that children with ADHD have deficits with inhibition. However, there has been little research done to study the same effects in adults with ADHD. Going a little deeper into the background of the study, in 1997, Quay suggested that an under-responsive behavioral inhibition system, or BIS, is to blame for ADHD. Due to this under-responsiveness, impulsive, hyperactive, and even inattentive behaviors ensue. That same year, Barkley took Quay's theory one step further and suggested the lack of inhibition had to do with a person's inability to prioritize and execute critical executive functioning, which include nonverbal working memory, internalization of self-directed speech, self-regulation of mood, motivation and level of arousal, and reconstitution, or the ability to break down overserved behaviors into competent parts. The purpose of this study at hand is to compare the response inhibition of adults with ADHD to normal and anxiety disordered adults. This is done by tasking the participants with 3 tests to measure their response inhibition, and then the results are compared. Next are the methods of study. We will cover participants and the variables tested and what the participants did in this study. The participants were adults who were between the ages of 18 and 65 years old and were separated into one of 3 groups: ADHD, normal, or anxiety disordered. According to the researchers, participants in the three groups did not differ significantly based on gender, educational level, or age. There were 30 normal control participants, 25 with ADHD, and 15 with anxiety disorder. None of the participants were taking medication at the time of the study. Any adults with ADHD were asked to discontinue their medication the day of the study if they were currently taking psychostimulants. As for the anxiety disordered adults, most were recruited during the intake to local mental health clinics and were not yet taking medications. The independent variable for this study were the participants' diagnosis, or lack thereof, for the normal group. As mentioned before, participants were separated into three groups: ADHD, anxiety disordered, and normal control adults. In order to classify participants, they were assessed using the Schedule for the Assessment of Conduct, Hyperactivity, Anxiety, Mood, and Psychoactive Substances, known as CHAMPS. This is a semi-structured interview administered by a clinician to assess DSM-4 ADHD symptoms. Next, a computerized version of the semi-structured clinical interview for DSM-4, known as SCID, was self-administered by participants. This was done to assess anxiety-related symptoms for disorders such as obsessive-compulsive disorder or post-traumatic stress disorder. The dependent variable in this study is the response inhibition portrayed by the participants. This was measured using three different neuropsychological tests. The Continuous Performance Test, CPT, was used to measure a participant's selective and sustained attention. This is done by having the participant perform a repetitive and boring task in which they must maintain their focus. The Posner Visual Orienting Task, or PVOT for short, is used to measure attention, specifically attentional shift. This task is performed by pressing the space bar when the participant views the asterisk on the screen. Lastly, the Stop Signal Task, SST, measures how quickly a response is inhibited. Participants were presented with either an X or an O and asked to press the key on the keyboard corresponding to each letter, either the Enter key for an X or the 0 key for an O. When participants heard a tone, they were supposed to inhibit their response and not press any key. As mentioned before, participants were assessed for their ADHD and anxiety symptomology. This was done using the Schedule for the Assessment of Conduct, Hyperactivity, Anxiety, Mood, and Psychoactive Substances. Then they self-administered the semi-structured clinical interview for DSM-4. Following that, participants were asked to perform the Continuous Performance Test, Posner Visual Orienting Task, and the Stop Signal Task. Participants were not given the results of the neuropsychological test performance. All participants were compensated financially for their participation in the study. The results of the study are outlined by the outcomes and takeaways of the study. There were more commission errors by the CPT by adults with ADHD when compared to anxiety disordered and normal control participants. Commission errors occur when there is a response by the participant, but no response was necessary, i.e., there was no target present. This indicates problems with impulsivity. Results for the PVOT displayed a trend of increasing impulsive errors for adults with ADHD, but these findings were not statistically significant. Lastly, there were no statistically significant difference between the groups while analyzing the results of the Stop Signal task. Overall, there were poorer response inhibition in adults with the ADHD group than in anxiety disordered and normal control participants. This was expected as it was hypothesized that this would be the result of the study. However, the deficiency in response inhibition was only present on the CPT. Still, these results are supported by findings on other research conducted with adult ADHD populations, in which adults with ADHD had more commission errors. Furthermore, findings on the continuous performance task are corroborated by similar research done with children ADHD populations. Finally, we look at the implications and conclusions of the study. To do this, we will discuss the significant strengths and weakness and main points of the study. Quay and Barkley proposed that an under-responsive behavioral inhibition system, BIS, is responsible for ADHD. This means that any deficits spotted in childhood should be present in adulthood. Furthermore, these deficits should be specific to ADHD and should not be representative of general psychopathology. This study partially supports this prediction by finding similar results in adults with ADHD as children with ADHD on the continuous performance test. Additionally, the results could provide support for the specificity of deficits in response inhibition. Strengths of the study include the use of the stop signal task due to the global nature of other neuropsychological tests, because it was thought that they measure other constructs beside impulsivity such as IQ. Weaknesses include the small sample size of anxiety disordered adults. This was due to comorbidity factors present. If anxiety disordered individuals presented with more than 6 DSM-4 ADHD inattentive symptoms, they were excluded from participation. This led to smaller sample sizes than expected for anxiety disordered adults. Additionally, a self-administered diagnostic procedure to measure anxiety was used in this study. It is unknown if this method has the proper psychometric properties, and it also gave multiple anxiety diagnoses. Finally, the main points of this study were that adults with ADHD showed deficits in response inhibition when compared to the anxiety disordered and normal control participants. This result is backed up by similar results in assessments involving children with ADHD and other adults with ADHD. However, it is important to take note that this was only shown on one of the 3 neuropsychological tests performed by the participants. When looking to future research, there should be a focus on how different neuropsychological tasks, with their varying task demands, could measure differently. The different brain functioning may be related to response inhibition in different ways. Here is my reference, which was the article, and thank you for watching my presentation.